did you buy all this stuff?
I went to buy things from the supermarket now.
Okay, you bought stuff last week.
Yeah, but haven't you heard that there's coronavirus? Me, I'm buying now because very soon there will be no food in the whole country, and then we're going to die here of starvation. Me, I have to buy everything now. I can't even take chances. You better go and start buying.
Yeah, I know about coronavirus, but you only need to buy the things that you need. Right now, it's an emergency, it's a global crisis, right? So you just have to buy the most important stuff that you need, like the hand sanitizer, the soap, the mask. And when you're buying, don't buy the whole supermarket, because you have to remember that others have to buy too, so that they can also, practice the hygienic precautions that have been laid out by the World Health Organization and the NCDC in our case. So for now, you just have to buy the only thing that are the necessary things that you need for this time of crisis, not the whole supermarket.
Oh, wow.
Yeah.
You're making sense. So now what am I going to do with all these vegetables?
Well.
Hello guys.
Hi.
So welcome to All Round Health Talk. Remember that last week in our video we told you that we're going to be making a new video that is titled How to Survive the Coronavirus. So here we have the video where we're going to teach you everything you're going to need, or show you everything you're going to need for this pandemic situation, and show you things that you really don't need right now, so to avoid buying unnecessary things. So the first rule in this pandemic situation is not to panic. Okay, so it's difficult to tell people not to panic when there is pandemic right now in the whole world, and every day we're hearing how many people have died and how many countries are affected, and we see how it's spreading like really very fast. But you have to be careful with your news. Try not to focus on the news. Watch one news once a day just to get the information, and don't overwhelm yourself with all those information, because it might make you begin to panic. So just try to calm down, do what you're supposed to do, wash your hands, social distance, and you'll be fine. No panic, okay?
And secondly, be cautious about information. Right now, due to this global emergency, there is a lot of fake news going around there. People are spreading fake news. People are telling others false information. So there are actually trusted sites like the WHO, the CDC, and also in case your country has its own version of CDC, like our country has the NCDC, you can also follow them to get day-to-day updates and correct facts about the COVID-19 pandemic. So beware of people spreading false information around, and don't fall prey to false advice also.
Okay, the next thing you're going to need is your surgical mask. Okay, if you remember 3 videos ago we made a video on how to wear a surgical mask. So basically you'll be needing this for this pandemic situation. This is not for everybody to wear. Okay, this is basically for those who are sick. If you're sick, you have some kind of flu, you need a surgical mask so that you don't spread whatever you have, whether it's COVID or not, just to be precautious. And also, if you're taking care of a sick person who has been confirmed to have COVID virus, you would need a protection. So if you cannot find the other mask, you can use the surgical mask, but it's not for everybody, so we shouldn't go around buying and wasting this. This is really very important at the moment for those who are in contact with the sick people, especially the doctors risking their lives every day. Okay?
Yeah. And the next thing you have to have is the soap and water. Right? This is very important, because according to the World Health Organization and the Chinese researchers that have researched about this virus, it is crucial for you to practice the hand hygiene, preferably with soap and water, right? For you to wash your hands not less than 60 seconds. It's very, very important for you to do that in order not to transmit the germs that you have on your hands from yourself to others around you.
Okay, next thing that you're going to need is your N95 mask, which we showed you how to use in our last video. Also, same here, it's not for everybody. Okay, those who are sick, those who are in contact with people confirmed that have symptoms of COVID are the only ones that should use the mask. We have to be conscious of the fact that right now in the world these masks are very scarce, and so we don't want to use them and waste them unnecessarily. We need to use them only when it's necessary. So if you still don't know how to use this, check out our video so that you can learn how to use it. Okay.
And the next is hand sanitizer. You have to have a hand sanitizer. Just a little one for when you're going out, you're going to come in contact with surfaces, chairs, tables, the rails, and people. So you have to have a little hand sanitizer with you so that you can disinfect your hand as often as possible. The hand sanitizer is supposed to have at least 60% alcohol for it to be effective. Remember that the recommended hand sanitizer is the alcohol-based hand sanitizer, and such is supposed to have at least 60% alcohol content for it to be effective against germs on the hands.
Okay, next thing you're going to need is your toilet paper. So many people are rushing to buy toilet paper in supermarkets all over the world. I don't know what they're buying it for though, but if you're not buying it for this reason, then you're just panic buying. Okay, so you need your toilet paper because it's better for you to sneeze into this. If you have a cough, if you have to sneeze, it's better for you to do this. Remember, like World Health Organization, so many health institutions are saying sneeze into your elbow, right? But it's safer for you to sneeze into this because you can take this, sneeze, and get dispose of it, right? Now, some people are also using handkerchief to sneeze into, but it's not really recommended because if you use handkerchief, you can always wash it and reuse it, and there is no assurance that after washing it, it's free of viruses, right? So it's safer for you to use something that you can easily dispose of. So you use your tissue paper, sneeze or cough into it, and you dispose of it properly. Okay, and if you don't have tissue paper, dab. Okay, good.
And the next is avoid overpopulated places, because you remember that the more crowded a place is, the more human contact you get, and the more the probability of you getting this infection increases. So try as much as possible to avoid overpopulated places. If you do not have to be there, then do not go there unless it is absolutely necessary or it's something that you cannot put off. Then you can, and if you do, please try to take all the necessary precautions that you have to take in order to prevent getting this virus.
Okay, next thing, don't panic buy. We've seen videos, everybody is panic buying, and it's not what we should be doing right now because the first rule says don't panic. So if you don't panic, you don't need to panic buy. Okay, you need certain things in your house. You need water, you need soap, you need hand sanitizer, you need your toilet paper, you need your mask in case anything happens, but there's no need for you to buy the whole supermarket. Okay, because then there'll be shortage of food and nobody gets food, and that is not fair. Okay, we have to be conscious of the fact that in this situation we are interdependent. You're not trying to save yourself, you're trying to save yourself and others. So if other people take care of themselves and you take care of yourself, then we are safe. But if you're only thinking of yourself, then you're not doing anything. Okay, so no panic buying. Buy what is necessary.
Okay, so next is social distancing, right? As COVID-19 disease is a disease that is principally transmitted from person to person, so it is paramount that we apply the social distancing precautions so that we reduce our risk of getting this disease from someone else. Obviously, we're within 2 meters because we're making this video. So.
On a normal, they will not disclose it just for the video, okay?
So yeah, try to maintain at least 2 meters distance from you and someone, especially someone who has the flu symptoms. Try to maintain 2 meter distance from them, and also in general, because there are some people who have the COVID-19 and they do not show any symptoms at all. So just be safe and practice the social distancing. And if for those of you who want to measure 2 meters, it's more like 3 to 6 feet from you, between you and the next person.
Okay, so next thing you have to do is please stay home if you are sick. Okay, most countries right now have enacted the whole state of emergency thingy, and so people at home. Here we're at home. Yeah. This is not Nigeria though, but here we're at home. So people are not on the street. People are just not going out because there is this state of emergency. Even and if you're not in a situation like this, if you're sick, please and please stay home. Okay, let's be considerate. Let's be considerate. If you're sick, if you have any respiratory symptom at all, just stay home. Don't try to show that you're Superman or whatever.
Hard guy.
No hard guy in this situation. Please stay home if you are sick.
Yeah. And the next is, well, try to disinfect surfaces, because you know that we touch things with our hands every day, right? And these germs are very microscopic. We cannot see them with the naked eye. So it is very frequent, and it's very possible for you to have contaminated hands, and as you touch different surfaces, they also get contaminated. So try as much as possible to disinfect every surface in your house with alcohol or non-alcoholic content, or no, with alcohol, with disinfectant that has at least 75% alcohol, right? So this is very effective for you to disinfect and clean the surfaces that are most likely to be touched in your house, in order to reduce the transmission of germs from one person to the other.
Okay, also, like we've said, older people are most affected by this disease. So please, if you are healthy, if you're strong, youth, try to check on the old people that live around you. Okay, it doesn't mean that you need to have direct contact or anything, but at least if you have phone numbers, try to call them. Do you need anything? Do you need groceries? If you're allowed to go out, then you can go out and help them get these things, because it's much more risky for these old people to go out in this situation. So let's just show that we love each other. Check up on the old people around you.
And nextly, beware of false people. Beware of false people, because at this time of global crisis, I've seen cases of people coming together in union solidarity, not like physically, but reaching out through technology, social media, and helping out in any way that they can. But there are also people who are taking advantage of the situation, especially people who produce basic things that we need at this time: the hand sanitizer, the soap, the mask, where they try to like increase the prices, increase the prices of these basic needs, and they try to make it make their personal gains. It's very unfortunate that at this time where people need each other the most, some people are taking advantage of the situation. So try as much as possible to beware of those people, and just help each other as much as you can.
Also, this is for the old people. So old people stand a higher chance of dying from this disease. So please, old people, if we don't have old people watching our videos, because I think most of our viewers are young people.
Yeah.
If you know any old person, please tell them, your parents, okay? If you have parents who are over 50, please take care of them. Make sure that they are indoors. In this situation, they shouldn't be going out, okay? So please, let's make sure of that. If you have any old person around you, grandparents, anything, just make sure they see this video and tell them they have to be indoors, okay? Please.
And the next is take care of children, right? So in some countries, they have actually stopped kids from going to school now, so most of them are at home. But you know, kids, they always look for every opportunity they can get to play around and, you know, just pass the time with their friends. But this is not the time for them to actually go out and start playing, or go to the beach, or go to the park or something. No, they're supposed to stay home, right? They can do their homework at home. They can entertain. You can find ways, as parents, you can find ways to entertain your kids. You can find ways to make them be productive at home, right? At this point in time where it is important to practice the social distancing and flatten the curve of the transmission of the disease. Now, I don't know, for some reason, they have found out that the immune system of children is actually able to suppress this virus, right? So your child might be infected, but he or she might not show symptoms. So this might give the parent a false sense of security that, okay, my child doesn't show any symptoms, so she's all good, he's all good. But no, that child might have the coronavirus disease, and when the child comes in contact with other children, there's also that risk of infection, that risk of transmission, and these children get in contact with their parents, and then the parents get in contact with their friends, and before you know it, it's just transmitting and transmitting. So we should actually take care of our kids. We should be conscious of this and stay home. That your school is closed doesn't mean you can just go out and play in the park, go to the beach and just go crazy. But stay home, right, and be productive there.
Okay. Also, be careful about the objects that you touch, especially if in those countries where people can still go out. If you're going to the mall, if you're going to use the subway, if you're going to use the buses, remember, like, the places where you sustain yourself in the buses or in the subway are things that other people touch, and you don't know who has touched it. Maybe someone with the virus, maybe someone with a different flu. Just be careful. If you can stay in the bus and not sustain yourself to those poles that they have, better for you. Okay, but if you find yourself in a place where there are so many objects that people come in contact, so just try to be careful with what you touch. Take your hand sanitizer so that you can always clean after touching anything.
Right. And next, know and detect symptoms. Right, there, you know that this is a respiratory virus, which means it starts with the normal flu symptoms: the coughing, the sneezing, the sniffing, sore throats, and then to the more severe variety, which is the difficulty in breathing and the pneumonia. Right, so you have to be able to track these symptoms and know when it is necessary for you to reach out to the hospital or go to the hospital. Right, it is not in every flu situation or allergic situations that you just go straight to the ER. No, we have to try to help the doctors and the health workers, right, so that we do not keep transmitting this virus. Know and be able to detect the virus, even the fever too, because in the COVID-19 disease, it is sure that you're going to have the fever if you start developing symptoms. So if you just have the flu and you don't have fever, then it is less likely that it is COVID-19. So you just have to stay home and do all the necessary, hydrate yourself, eat well, rest, and within a few days you should be better. Right, only if you start feeling the more severe symptoms, difficulty breathing, the pneumonia, then you can go to the hospital.
Okay, so another thing we have to do in this situation is self-isolate or self-quarantine yourself. So, like we said, so many countries have enacted the rule that people shouldn't go out. So, if you're in one of those countries, US, Ecuador, wherever you are, Italy, stay home. Okay, it's boring. Yeah, there's so many things you can do: exercise, eat well, read books, watch TV. You can be on the gram, stay away from news.
Reach out,
Yeah, text,
yeah.
call people.
Yeah.
Okay, drink a lot of water while you're at home. Okay, so really just follow the rules. If they've said don't go out, then just please stay at home so that you don't keep making it even faster for this virus to transmit. And then there are other countries, most countries right now, when you're a contact of someone with COVID-19, be it that you have symptoms, if you don't have symptoms and you've not tested positive or for the virus, they tell you to self-quarantine at home. Please and please respect that. If they've told you to stay at home, because there have been cases of people who were supposed to be self-quarantining at home and they were busy all over the street and everything, and since they didn't have symptoms, there was a possibility they already had the virus, and that was how it was even transmitting faster. So please, if you're supposed to self-quarantine, stay at home.
Yeah. And next, if you're suspicious that you actually have the disease, for example, if you have been in contact with someone who is suspected to have the virus, or if you have traveled to a state or a country where there is a high number of reported cases of COVID-19, and after such activity you start having the flu or the sore throat, fever, and you start having difficulty breathing, I'm sure there are emergency numbers that you can call according to each country so that you can get in contact with a health worker that will interrogate you and know if it is necessary for you to go to the hospital, right? Because if you have the mild cases, it's not necessary for you to go to the hospital. You can easily recuperate at home. But if you have the more severe illnesses, the more severe symptoms, then the health worker will know how to get in touch with you, if they will bring an ambulance and come to your home and transport you directly to your hospital, or if there's a way they can organize transporting you in the best manner so that you do not get in contact with people and transmit the virus that you have to them, at least until you can get tested with for the COVID-19. For Ecuador, I think it's 171,
Yep.
the emergency numbers. Yeah. So I'm sure that there are emergency numbers according to your country of residence.
Okay, and last but not the least, let's be considerate about each other. Okay, so this planet belongs to all of us, not just to one person or one family. So we have to be conscious. We've said if you're buying, please think of others. Don't buy the whole soap in the supermarket and forget that other people also have to do the hand hygiene. Okay, because right now we all need to work together to stay safe.
Yeah.
So if you're thinking of yourself alone, then we cannot stay safe. Also, be considerate about the doctors who are risking their lives on a daily basis to treat patients who already have symptoms. Most of them don't get to come out. Most of them end up being quarantined there. Most of them fall sick, begin to show symptoms. So be considerate. If you don't really have anything that is of a big
huge significance.
Exactly, of huge significance, then don't go there. Don't collapse the health system. Right now we need the health system to be functioning, to be able to survive this pandemic situation. So please don't collapse the health system. Pray for the doctors. If you pray, if you believe in God, if you believe in the universe, whatever you believe in, just pray for the doctors and just pray for the world in general. And also, we are doctors, and if you feel like you have any symptom that is not severe, or you have a health situation and you don't know how to act about it, or you have a health doubt, you can write us on our in the comment section. Facebook, you could also write us on IG if you follow All Around Health Talk on IG, and if you follow us on Facebook, I'm Zabeth Onyembata on Facebook, and she is
Eze Celestina.
So you can follow us, and if you have any doubts, just write us rather than going to the hospitals or to the ER and collapsing the whole system. Write us, and we'll do everything possible to try to help you, to explain what you're having and what you should do while at home, so that you don't go and make it even much more difficult for the doctors to work. Okay, so yeah, this is how you get to survive COVID-19.
That or the Miss Rona. Some people have even
people have called it Miss Rona
nickname, you know.
Nigerians are calling it Comfort Words David. So COVID-19,
that Rona. So that's all we have for how to survive the coronavirus. Hey guys, so these are basically the most important things that you need during this COVID-19 pandemic. So remember, don't panic, buy. Okay?